Hi guys, welcome to Target IAS. This is Neha Bolgam and you are on the 5th episode of Government Schemes Series 2021, which is being prepared in anticipation of the preliminary examination of UPSC that is to be conducted in the October month of the very same year. Before heading into today's ministries and discussing their schemes, features and ending with the prelims practice questions, I would like to take a minute and thank each of you for all your love in the form of the viewership, in the comments and personal messages. I really appreciate it a lot. It keeps me going ahead and giving you good content. At least on that note, today we are going to discuss about the schemes under the Ministry of Health and Family Welfare and under the Ministry of Electronics and Information Technology. So let's delve in. And firstly, we have the intensified mission of Indradhanush 3.0. As this name for many of you might ring the bell, that its objective being universal immunization program in India, and the facts being that the target group under this immunization program with major focus are children under 2 years and pregnant women. And under the Indradhanush immunization program 1.0 and 2.0, we had 6 diseases covered, while one added feature or fact that you have to remember is under the 3.0 mission, this has been expanded to 12 more diseases. So let us understand more with the aid of the following infograph. The major reason why I'm discussing this Indradhanush 3.0 scheme as the first scheme today is, of course, because it has a relation with the COVID-19 and has been recently in news, where it is going to focus on immunizing the children and pregnant women who has missed their vaccine doses due to the pandemic and the lockdowns thereupon. And the scheme's major aim is to achieve 90% of pan-India immunization cover by 2022. And coming to the diseases covered under this, initially they had diphtheria, pertussis, tetanus, childhood tuberculosis, polio, hepatitis B and measles. While now we also have the whooping cough, polio, meningitis, pneumonia, hemophilia influenza, Japanese encephalitis, rotavirus vaccine, pneumococcal conjugate vaccine, measles, rubella and etc. So all of these have been expanded into the 12 diseases that are covered. However, you have to keep in mind that the Japanese encephalitis and Haemophilus influenza, being a rare type of disease, both these vaccinations are being provided only in select districts of the country where there is a need for them. And it goes without saying that since this being a government scheme, all the vaccines are available free of cost under the immunization program. Now, having talked about this and why is it in news recently, next ahead we have this beautiful umbrella scheme that is the National Digital Health Mission. And this is a complete digital health ecosystem available in the form of app and website. This is quite clear as it has already been given as a cue in the scheme heading where it says digital. And a very important point for you all to remember here, it is that it is being implemented by the National Health Authority. In this infograph on the National Digital Health Mission, the key factors to focus here are firstly this block, and here under the National Digital Health Mission, it will be launched with the aid of 4 key features such as the Health ID, the personal health records, a Digi Doctor and the health facility registration. Telemedicine and e-pharmacy are the shootouts of the 4 key features that have been launched. Now let me give you a one-liners for the sake of understanding of the nature of the 4 key features launched. So the most innovative one here, the Digi Doctor option, allows doctors from across the country to enroll, and their details including their contact numbers, if they want to provide them of course, will be available in the registry and to the patients. And next we also have the National Health ID, which is a repository of all the health related information of every Indian. So once you get in contact with the doctor, all the prescription and the medicine that he suggests to a patient is registered within the system under the name of a health ID. This is to ensure that all the information, health information, is centralized and kept with the government rather than being left at the hands of the patients. And the guiding principles under this are, it is a voluntary participation, as I told you, for both the doctors and the patients, and the data sharing is done with consent. They of course have the privacy and security by design within the implementation of the program. But yet, of course, we do not have a data security bill in India, which is also a primary concern. Along with that, but which has been assured as a guiding principles in here. Along with that, we have the policy of inclusivity and seamless portability of the patients in getting connected with the doctors or their medications and etc., since it is all digital. And under the National Digital Health Mission, it aims to establish the digital health systems and managing health data, as you must have understood from the above features that I have explained. This in turn will help improve the quality of the health and storage and dissemination of the data. It provides a platform for interoperability of healthcare data, which is very important because we have a lack of interconnection, and this is where the portability feature comes in. And we also have a fast-track creation of updated and accurate health registries for the entire country. So I think this infographic itself is like a mains answer question for you, where this comes under the features, and both these come under the benefits or the pros under the National Digital Health Mission. Before going ahead, let me give you a brief idea of the genesis of this concept of National Digital Health Mission, which has been envisaged by the National Health Policy of 2017. And it aims at improving efficiency, transparency, and citizens' experience with linkage across the public and the private healthcare. Next, here we have the Pradhanmantri Jan Arogya Yojana. And this in brief is a health insurance scheme. And let me come to the facts later once I make you understand briefly what are the contents of the scheme. So here under the Pradhanmantri Jan Arogya Yojana, the major thing you have to understand that the whole scheme is a component under the Ayushman Bharat umbrella scheme. And this is to, of course, as I told you, to achieve the universal health coverage by assuring financial aid in the form of insurances and etc. Now let us understand how this is done by the following features. One unique feature of the Pradhanmantri Jan Arogya Yojana is that it is the world's largest health insurance, which is a very proud factor for India. And this is not only because of the given size of the country, but also given the magnanimity at which it is being implemented across the country. And the main features include that it provides a cover of rupees 5 lakh per family per year for secondary as well as tertiary care, and that includes hospitalization, and that is to both the private and the public healthcare centers. It also covers 3 days of pre-hospitalization and 15 days of post-hospitalization expenses such as both diagnostics and medicines. And there is a priority given to the girl, women, child and senior citizens when it comes to the treatment accessibility. There is already the pre-existing diseases covered under the scheme, and the payment is also paperless, that is cashless, and it is being supported by Arogya Mitra, where every empaneled hospital has a dedicated Arogya Mitra to help patients throughout the process. and there is no restriction on the family size, on the age, gender, or which territory that they belong to. So that means that it has a pan-India level access, and this is the most important feature that I said I will get back to you. So when it comes to selecting people for the insurance scheme, there is a process where only the vulnerable households are included, and that also based upon the deprivation and occupational criteria of the socio-economic caste census 2000 level for the rural and urban areas respectively. So they are considering the SECC survey and the results that come out of it for ensuring that they actually take in the vulnerable people who are in need of the insurance scheme. Moving ahead, we have the Pradhanmantri Swasthya Suraksha Yojana, which is aimed at upgradation of the facilities for quality medical education. This is a central sponsored scheme, which means that the funding for the scheme is in ratio proportionate division between the center and the state. And please remember these words for you to remember the scheme better. It just aims at setting up of AIIMS and similar medical educational institutions. So the key term here is that the Swasthya Suraksha Yojana. It means that ensuring the health of the people, and you can only ensure the health of them by setting up more infrastructure, that is the medical infrastructure across the country. So here, let me aid your understanding of this. As I told you, the Swasthya Suraksha Yojana mainly aims at setting up AIIMS institutions and upgradation of the government medical colleges and institutions that are already existing. So why is this recently in news is that recently 22 new regional All India Institute of Medical Sciences, that is the AIIMS, have been approved, and this is the status of the scheme of the AIIMS that are being in function, are under construction, or where the classes have started and where the activities are in progress, and etc. This further details is not necessary. You just have to remember that this scheme is related to the infrastructure development of the medical colleges. We further have the Nikshay Poshan Yojana. Here I would like to make a small note that given that the word portion, you should not be confused that this scheme is towards target population of under or malnourished children or pregnant women and giving them the necessary nutrition. No. This is the primary reason why I have included here. Its objective is for the tuberculosis control under the National Tuberculosis Elimination Program, and this is again a central sponsored scheme, and it is a direct benefit transfer scheme where cash is being directly transferred to the target population. Let us understand that better through this infograph. Now this scheme is a recent launch in the year 2018, and that is under the National Health Mission. And as I told you, it's a DBT scheme, the direct benefit transfer, where a financial incentive of rupees 500 per month to each TB patient is being provided for their nutritional support or medical support during the treatment. And under this Yojana, there has also been a launch of Nikshay portal, which is a web-enabled patient management system. With this being the scheme at a national level for the tuberculosis control, we also separately have a tribal TB initiative, which I thought I would also mention for the sake of swooping them all into your mind at the same time while we are still at the topic of discussing tuberculosis. And yes, this scheme has been implemented by a unique partnership between the Ministry of Health and Family Welfare that we are currently discussing, and also the Ministry of Tribal Affairs, to improve the cascading tuberculosis care, support, and etc., their expenses, and providing separate aid to the tribal populations in India. Having discussed various schemes, important schemes by that I mean, under the Ministry of Health and Family Welfare, such as the Indradhanush, which is the immunization program, National Digital Health Mission, under which an umbrella infrastructure of digital health infrastructure has been introduced into the country, the Pradhanmantri Arogya Yojna, which is the insurance scheme, Pradhanmantri Swasthya Suraksha Yojna, which is the physical infrastructure, while the second scheme is the digital infrastructure, and the Nikshay portion Yojana, which is towards eradication or elimination of the tuberculosis situation in the country. We move ahead into the Ministry of Electronics and Information Technology of the Government of India. And today, the first scheme here is the COVIN, which is the COVID Vaccine Intelligence Network, which I am sure every aspirant have heard it like 100 times until now. So, but I would like to add upon a nice interesting fact that I have come across. The objective of the scheme here is that it's a digitized real-time platform to effectively roll out the COVID vaccination drive. So this again is related to the COVID and the recent times. And before discussing the features here, let me take you to the infograph, and via that I will route you back to the table. So the COVIN, as I have just told you, is the digitized real-time platform to track the vaccinations, its registrations, and how it has been implemented across the nation. It is non-negotiable. That means you have to get your vaccination done by registering in the COVIN website for you to get a certificate telling you that you've been vaccinated, and to use the certificate while traveling or other such. And it also has the feature that every vaccine has to be recorded and updated in real time as you give it to the person, and it must be issued through one body to avoid misuse. This is very important. Misuse, along with misuse, you can also include the factor of minimal wastage, where a strict monitoring has been implemented. So through this, as I have told you, you can book appointments, reschedule them by choosing the time and the center that you wish to go to. You can also get the authentication that I was talking about, the certificates from the app. Now, one important fact that I thought of discussing in this video about this scheme is that the COVID Vaccine Intelligence Network, otherwise called as COVIN, till now has been monitored using the EVIN, that is the Electronic Vaccine Intelligence Network. With integrative features such as including the private hospital systems and undertaking of particularly the COVID vaccination drive. Having understood the genesis of it from the EVIN platform, let us get into a couple of facts. That is that for registering and etc. in the COVIN app, the Aadhaar enabled authentication is mandatory. And of course, this is under the Ministry of Electronics and Information Technology, and it is also being, the data and etc. are also being handled by the National Informatics Center. The next scheme under discussion is the Digital India program, whose objective is transforming India into a digitally empowered society, focusing on 9 pillars of growth areas. Like the Atmanirbhar scheme, which is dependent on 5 pillars and their roadmap there, we have 9 pillars here under the Digital India program. Please kindly do not get confused with the National Digital Health Mission that I have discussed above with the Digital India program. These are 2 different ministries and 2 different schemes entirely. For further clarity, let me discuss the 9 pillars. So basically, these 9 pillars have also been brought into place by visioning 3 components, and that is the ensuring and building digital infrastructure for every citizen alike, ensuring efficient governance and delivery of services, and also digital empowerment of citizens in general. So to achieve these 3 components, we have the 9 pillars. And these 9 pillars are nothing but growth areas that have been identified for the overall growth of the digital empowerment of the citizens. And these being Broadway highways, universal access to mobile connectivity, public internet access program, information for everyone, early harvest program, IT for jobs, e-Kranti, this is a very important thing that I will come back to, e-governance, this again, and also the electronic manufacturing target net zero imports. So try and remember all the features briefly, and I will of course discuss the most important ones with you. The e-Kranti here is the electronic delivery of services along with information and etc. to all. So this is basically focused only on the services sector. And under the e-governance, we have several apps such as the Umang app that has been launched, which I'm going to discuss in the further slides. And recently, as this scheme has completed 5 years, the Digital India Internship of 2021 has run its due course of the first cycle and has entered into the second cycle. So thus the Digital India, especially empowerment in the Digital India, is important to achieve the motto of the BJP government, that is maximum governance and minimum government. This is a catchy phrase. Try and remember that to reflect that in the mains paper. Now going ahead, we have the Umang app that I told you is to ensure the e-governance under the Digital India scheme that we have just discussed above. And this app enables all the essential government services such as paying taxes, that is filing income tax returns and checking your provident fund balance, and ensuring the Aadhaar and Digi Locker apps. The Digi Locker is again a very prominent feature which I will be discussing in the further slides, which helps you pay bills such as the electricity, water, gas cylinders and etc., booking them. And it also helps you apply for jobs under the Pradhanmantri Kaushal Vikas Yojana, which comes under the Ministry of Skill Development. And you also have the one-tap access to all the approved AICTE approved colleges across the country. It also guides you through how to apply for them and etc. So here are the key features. It provides you access to around 162 services across 33 government departments, and it's a multi-platform access, like you can access it through desktop, laptop, mobile phone and etc. It is available in many regional languages, making it inclusive of all the sectors of the community, and it can have an access from feature with the USSD. And a unique feature of the Umang app is that it also has an international version which was launched for select countries such as USA, UK, Canada, Australia, UAE, Netherlands and etc. so that the Indian international students, NRIs and the Indian tourists abroad will be able to avail the Government of India services anytime. And it also will help in taking India to the world by displaying the Indian cultural services available on the Umang app and create interest among the foreign tourists to visit India. Having discussed about the program, the Umang app, and next is the Digi Locker feature, which is a platform where you can store your documents in electronic version, and of course this is under the scheme that I have just spoken about. Going to the slide of it. So the Digi Locker is a flagship program aiming to transform all the documents that the citizens have into shareable private space on a public cloud. So the key features here is that you have shareable, printable, scanned documents of all yours that you can share on this platform, and all of this is being saved on a public cloud under the IT preservation and retention of information by intermediaries providing digital locker facilities rules 2016. Now this is again a key feature that you need to remember. And how do you go about using the Digi Locker platform is that you download and install the app. You sign up using your phone number, Facebook, Google account like you do for any other apps per se now. And then you mandatorily sync your Aadhaar with it. You fetch the documents and then you share the documents, you verify them and submit them in that. So this is generally because you can just, the benefits, how are they going to benefit or help is that you can access them and store them from anywhere. So this is generally a very portable feature, and this also includes your private documents such as the insurance, the medical reports, the PAN card, passport, marriage certificate. Ask what, you can just load everything up there and safely keep it. And this can be accessed by people using your mobile phones, etc. It is just like a Google and Dropbox facility that offers storage space to you, but just that the provider here is the government rather than a private service. And it also provides the users with a URI link of the e-documents. Along with the above features, it will also help reduce the administration overhead of the government documents. Along with the other benefits that I've just discussed, the Digi Locker will help reduce the administrative overhead of the government departments and agencies and just make it easier for them to receive the services, given the authenticity is being provided by the government, and etc. Now moving ahead to the last scheme of today under the Ministry of Electronics and Information Technology, we have the Internet Protocol IPv6 that has been recently launched by NIXI, that is the National Internet Exchange of India. Now this is a communications protocol. Do not worry with the technical jargon in the scheme. I'm gonna break it down in simple terms for you. So firstly, the scheme under discussion is the IPv6, which is the Internet Protocol v6, and this is being launched by this particular platform, that is the National Internet Exchange of India. What is this? It is an NPO, non-profit organization, established in the year 2003 under the Companies Act. So the main feature is that the NIXI offers free domain in local Indian languages for someone who wants to come up with a website of their own. And this offer is only valid up to the 31st January of 2021. Let me read the objective of this particular platform here for you. It acts as a neutral meeting point of the internet service providers with the primary objective of facilitating exchange of domestic internet traffic between the peers. NIXI has launched the IPv6, the Internet Protocol v6, under today's discussion, and for this launch it has also launched 3 associated initiatives, such as which is a joint effort of the Department of Telecommunications and the Department which is a joint effort of the Department of Telecommunications of the Ministry of Electronics and Information Technology. And this is majorly to promote the adoption. The expert panel is to come up with initiatives to promote the adoption of the Internet Protocol V6. Repeat. And having understood the infrastructure in place for promoting the new protocol, let us understand what the protocol is. And here I have taken up this table comparing the IPv4 and IPv6 is because the IPv6 is a development and an advanced version of the Internet Protocol v4. So primarily the IPv6 is a portal for the internet community to showcase and identify the location system of computers or networks and route the traffic between the internet known as the IP address. This is more secure and more faster. The positive features are that it's secure and faster than IPv4. So here, as you can see, the address size is the 32-bit number and here it is 128-bit number. So it means that it is a bigger address size and the space is bigger, which is enables them to easily organize and efficiently implement their services. And the addressed format, here is a dotted decimal, while here it's a hexadecimal notation, and it is better suited to handle mobile networks. So these are all the positive features of the IPv6 over the IPv4. When it comes to the security aspect, it is mostly dependent on applications, whereas it has its own IP security protocol, the IPsec, which makes it more safer. And lastly, coming to the configuration of the network, here they are either configured manually or with the help of an external aid, while here it is automatic configuration, which makes it faster. So these both are the features that we have just discussed, that they are faster and secure. Now, before leaving you all with the IPv6 concept, I want you to know that both these, now it doesn't mean that IPv6 is under operation and IPv4 has to get obsolete. No, both of them can coexist on a parallel network, and there is no immediate incentive to upgrade into the IPv6 platforms, because migration of course requires the considerable amount of time and budget which has been given to the providers. So these are the schemes that I wanted to discuss today with you guys, and before leaving the questions to you, I would want to make a small note here. I have again come up with a small experiment that I wanted to make. In the first 3 videos, I have provided questions based upon the schemes that have been discussed in the video. In the last video, that is the 4th episode, I have given questions after every 2 schemes, and in today's video, I'm giving questions that are unrelated to the schemes discussed here. That is only to encourage you to briefly Google about the schemes that I have provided in the options, about the question on the overall, and get some bit of extra information about the schemes asked in the questions. And of course, that being it, these are also the schemes that have recently been in news, and I wanted to ensure that these have been asked in the form of questions to you guys, and I promise I will discuss the answers and the content of these questions and the schemes that I'm asking now in the next video. This is the 6th episode. So let us read the questions. The first question here is that what is the name of the movement launched by the Health Ministry to emphasize on nutritionally balanced diet? Is it the Nikshay Poshan Yojana, Ahar Kranti, Anemia Mukt Bharat Strategy, Integrated Health Information Platform? Read up about this and please provide your answer in the comments. And the second question for today is that what is the name of the startup challenge launched by the Union Ministry of Electronics and Information Technology? Is it Chunauti, Swagat, Sanrakshan, Chunav? So both the questions, as you can see, are quite simple worded but very informative. Please try and go into each scheme and understand about it, and we will discuss the answers in the next video. So please try and revise all the videos provided until now. They will really help you in answering Prelims 2021 and also help you in mains answer writing when a question comes about asking related to the initiatives or the government steps taken in the Ministry of Health and Family Welfare, given the COVID in context, where you can bring up all the above schemes such as the Indradhanush scheme, the Pradhanmantri Swasthya, Suraksha Yojna, the National Digital Health Mission. Given that COVID has brought in the aspect of social distancing and etc., the National Digital Health Mission actually helps build up the digital infrastructure and is quite helpful in the current scenario. So these are just advices I'm putting in here and there, and trying to build up a thought process for the audience who are seeing the videos. With this, I leave you for today. We'll see you in the next week. Thank you.